video, we'll go over the priming, programming, and attaching a primary infusion to your patient's peripheral IV normal saline lock. So we're going to be using the B-Braun pump, which has now been instituted in most of the facilities in Winnipeg and Manitoba. So this is a bit of a new pump. It might be hard to see the screen as I go along, so just make sure you refer to the step-by-step if you need to. This is available in lab, and it's also available online as well on Learn. So the first thing we want to do, of course, is make sure we do our hand hygiene, and we're going to check our physician orders. And the team will often order an IV infusion for a patient who, for various reasons, maybe they dehydrated, maybe they need some supplemental saline or potassium, maybe they're NPO for a while. So there could be a few reasons why a patient needs an infusion. Maybe they have antibiotics they require as well, or different medications. So we'll check the MD orders to see what infusion we require, how fast we should run it. So we would check to see what they've ordered. It might be normal saline, it could be D5W, it could be a combination of D5 and half normal saline or 0.9 normal saline. There's a lot of different varieties. So you would have to be very cognizant that you pick the right bag. So the bag is labeled clearly on what it is, so normal saline, 0.9%. And this is a 1 liter bag, and this is the biggest bag. So the size that you pick is also dependent on how fast your infusion is running. So if your infusion is running very fast, say 100 mLs an hour or 200 mLs an hour, you might want to choose a larger bag. That way you don't have to change it as often. If your infusion is only running at, say, 10 or 20 mLs an hour, that's not very fast. So you could pick a smaller bag if you wanted. Okay? So just make sure you check normal saline or D5W. Sometimes infusions also have potassium in them as well. You'll learn more about this in Skills 4, but you'll just want to see the red labeling there that says there's potassium in there, and that's a high alert medication. It would be a 2-nurse check. Again, that would be in your MD orders as well, and this one would also be in your MAR. For most infusions, whether they're normal saline or D5W or D5.9, they will be only in the MD orders. They won't be in your MAR, okay? So just verifying you get the right solution and you have the right infusion rate. So we'll do our hand hygiene. We'll identify our patient. So just make sure as well that your MD orders matches your patient's name band. Okay, so we'll check to make sure that the name matches, and also one identifier. Okay, so either their date of birth or their MRN or FIN number. You can also verify with the patient as well if they're able to speak to you or to nod their head yes or no. Are you Porcio Parsons? Can you tell me your date of birth? Usually they don't know their MRN number or their FIN number, so we don't ask them that. The other thing we want to do too is we want to make sure that our peripheral IV is in situ, because if it's not, we might have to start a new one. So we'll put our gloves on. Okay. And we're just going to swab the port there. 30 seconds, dry for 15, and cleanse it really well. Okay, and then we have our pre-filled normal saline syringe. We're going to make sure that we get the bubbles out. That's very important. Okay, because we don't want to put any bubbles into our patient's IV. And then we're going to flush that IV. And as we're flushing it, we're going to ask, is that painful at all? Does it hurt? And we're going to assess the site as well. Is there any bubbling, any redness, any leakage, okay, any swelling? Okay. We could also even pull back a little bit on the syringe, and sometimes you'll see a flash of blood if the IV is well into the vein. You'll see a little flash of blood come into the tubing, and then you can flush that back into your patient. Sometimes when you aspirate back, you might not get a flash of blood, and that's okay. Sometimes veins just won't give you the blood return. It doesn't mean that they're a bad IV. It just means that it's not going to give you any blood return. So in that case, it's just really important that you do a really good check when you're doing your flushing. Okay, no pain, no tenderness, no leakage, no swelling. Okay, and that it flushes with ease. If I was having to push really hard on this syringe to try to get the fluid to flush, I'd be a little concerned that it's interstitial or it's gone into the tissue and that it's not in the vein anymore. We'll lock that off and we'll just put it to the side there. Okay. So now for our pump, just dispose of our gloves and hand hygiene. we'll grab our bag that we require. So I'll use normal saline. And when we pick the bag as well, we just want to make sure that it's not expired. And usually it's in a wrapping as well. We want to make sure that it's not leaking. We also want to turn it over and look to see that it's clear, there's no fibrin, and there's nothing floating around in there making it contaminated. Okay. Now, because these bags have been used a lot in the lab, if I pull this blue tab, the fluid is just going to drain out. Normally, when you're in a clinical situation, you can pull this blue tab off on a brand new bag, and there's a little seal in there that won't let the fluid flow back, okay, on a brand new bag. The seal has been cracked already in the lab because we've used these so much, okay? So in the clinical setting, you could just hang and spike your infusion. We can't do that here in the lab. So we're gonna grab our IV tubing, and this one is the ported tubing. So you can see it's got ports to it, and that's the one we're gonna use for our primary infusion because it's got ports for us to attach a mini bag, and it's also got ports lower down so that we can give an IV push medication. So we're gonna take off that protective cover, okay? And don't let it touch anything because we want this to maintain sterility. We're going to take off that blue cap here. And I'm tilting the bag back because if I go like this, it's going to spill at me. Okay, and then maintaining sterility, we're going to spike that bag. Okay. And I'm just going to close the roller clamp here because I don't want it to flow out when I hang this up. So I'm just going to hang this up here. Okay, and gravity is going to kind of pull a little bit of solution, and I'm going to fill this chamber half full. You'll also notice that there's a little tab up here that can allow some venting for the chamber. So if you were hanging like a glass bottle of a medication, or if you were giving albumin or HSA, which comes in a glass bottle, you would open this venting. For us, we're using bags, no need to open the venting. We're going to keep that venting closed, okay? So no need to do anything with that. So we spiked our bag. Now we're ready to prime our tubing. And now with this pump, it will prime the tubing for us. There is a way that we can prime the tubing on our own, but it's not encouraged by the company. So at the end of this tubing, there's something called an ASV valve. And so if we took off the ASV valve, which is an anti-siphon valve, if we take it off, we can free flow prime it. We're going to prime through the pump though, so we're going to keep that cap on. So for the pump, it's already on standby. If it wasn't on standby, if it was asleep, it turned off, we would just turn the on-off button and that would fire it up, okay? Because it's on standby, we can just go ahead and open the door. It's gonna ask, opening door, is the IV line clamped? Well, the IV line isn't in there, so that's okay. So we're gonna say yes. Okay, perfect. And I'm actually going to move this to the other side because the pump goes from right to left, and we can thread our tubing in there now. Okay, so this is almost like a purse handle. This is going to go to the top. Okay, the purse handle goes in the top. We're going to fit that in just like that. Okay. And then we're also going to tuck in the tabs on the side and just make sure it does not get pinched. Okay. Okay, and then this tab here, we're going to push it in there, and you can hear it clicks. Okay. There we go. We're going to close the door, and you can hear it loading the tubing there, and it's just going to take a minute to do its little bit of setup there. Now, after we've put up our bag, we also want to make sure that we label it. We have to change bags every 24 hours, okay? So in 24 hours, I'm going to put up a new bag. Whether this bag is empty or not, I need to change it, okay? So we'll put on a label to say that we primed it today, we spiked it today, and also for the tubing as well. We're going to label that tubing as well. Tubing is good for about 96 hours or 4 days, but check your institutional policy as well to see how often you need to change it. So I put the date and time on there. All right, so my pump is ready to go. Prime IV line, 23 mLs. I'm going to say yes, so I'm going to do the up arrow. Okay, disconnect IV line from patient before priming. So yes, of course, I would want to make sure that this is not hooked up once it's priming, because otherwise all this air in the tubing is going to end up going to my patient. So not connected to your patient yet. So okay, so it gives it a nice safety check there. So the priming volume is going to be 22 mLs, and you can see it's pulling from the bag automatically. Now we have quite a few ports, 3 ports on this tubing. So what happens is the air gets caught in these ports. So to get them out, we're going to flip them upside down. And you know how air rises, right? So if we flip it upside down and tap on it, you can see that the air is going to go through the tubing. Oh, downstream occlusion. Oh, I bet you it's because I have it still clamped. Okay, so open that roller clamp. There we go. Priming stopped. Okay. Okay, is repeat priming? Yes. So there we go. It's going to walk us through this. So now it's going to keep going with priming. Okay, so we flipped that port. Now we're going to keep going down our tubing. Okay, flipping the next port. And you can see those bubbles coming out of the tubing. Okay? So really important to flip those ports. Tap, tap, tap. Okay, and keep going. Flip your tubing. The fluid's not there yet. Let's see. And you might want to do this over a garbage can. Okay. Make sure that you don't put the end of your tubing into the garbage can. We don't want to contaminate that ending or make it dirty. Okay. Flip it over. There we go, tapping it out. I'm just inspecting to make sure all the bubbles are out. There we go, priming is stopped. And so if we needed to reprime, we could, and it'll prompt us repeat priming. So we could yes or no. I'm happy with the priming. All the bubbles seem to be out, so I'm going to say no. Okay, now it says we can program an infusion. So let's go okay. And we're going to be adult general. So we'll click into there and we'll program that this is just a regular IV fluid. So we'll scroll down to that and then left arrow. And it's going to ask for the rate. And remember, we're going to check our physician orders to see what the rate should be. The rate on this physician order says 25 mLs an hour. So that's what I'm going to program. And you always want to make sure that that's appropriate for your patient as well. So we're going to scroll using the left arrow and the up and down arrow to identify 25 mLs an hour. And then we'll press OK. And then we're going to scroll down to VTBI, which is volume to be infused. So that would be how much is in this bag. So there is 1,000 mLs or 1 liter in this bag. However, I wasted a little bit when I was doing my priming. So what I like to do is I like to under program a little bit so that my bag doesn't go dry, because it's such a pain, especially for the next nurse. If this IV tubing goes dry because it sucked the bag dry, then you have to reprime new tubing. So that's a bit of a pain. So in order to prevent that, we're going to under program the amount so that it will prompt us to come and change the bag early before it goes dry. So, and there is a bit of overfill in these bags too, but I'm going to say I wasted about 50 mLs, which is a bit of an overestimate. So instead of 1,000 mLs, I'm going to put 950 mLs in here. Okay, so left arrow, and I'm going to scroll and put 950. So if you were using a smaller bag, you would put in maybe 200 mLs, okay, if you're using a 250 bag, okay? If you're using a 500 ml bag, maybe you want to put in 450 mLs, okay? So under programming is slightly. Okay, so we got 950 mLs there. I'm going to press OK to confirm, okay? And then we should be ready to start. So I'm just going to do my hand hygiene. Now, because I swabbed this a while ago and I put it back on the bed, I'm going to re-swab it with a new alcohol swab, and I've already flushed it, so I'm happy that it's in situ and it's a good IV. So I swabbed it for 30 seconds, let it dry for 15, and I'm going to grab the end of the tubing. And maintaining sterility, we're going to take the end off of this tubing. There we go. Making sure we don't touch the end of the tubing. Okay, we don't want to contaminate that. And we're going to attach it to the port that we just cleaned, the interlink port. Okay, then we're going to unclamp it. And we're ready to start. There There we go. So we'll make sure all of our clamps are open. Okay. And we can see the arrow shows that it is running at 25 mLs an hour. And that's how you start and prime a primary infusion.